Tom Snedden. I'm the director of the Pennsylvania PACE program, which is a pharmacy benefit for qualified older Pennsylvanians. We serve about 350,000 older Pennsylvanians a year. It's one of the most comprehensive benefits in the country. And with that comes a responsibility on the part of the administration of the program to make sure that people are getting optimal drug therapy, which means ensuring that they're not being prescribed the wrong medications, too much of the right medications, and they're being prescribed medications that they need to effectively treat their conditions or diagnosis. To do this, we have a number of different ways of ensuring that people do get the right medications. And one of those ways is by providing a physician education program. This physician education program is overseen by the ALOSA Foundation, which is a nonprofit foundation at the Harvard Medical School and the Brigham and Women's Hospital. We've had this program in place now for 10 years, and it has provided over 1,000 physicians in Pennsylvania with unbiased, non-commercial drug education on a variety of different things, from effectively treating depression, to avoiding falls, to staying out of nursing homes, to making sure that people are getting the right drug therapy.
A real problem for doctors who care for any patients, but particularly older patients, is to know when to use what medication in what dose, what's safe, what works, what doesn't work. And it's difficult to keep up with the literature. There's new papers coming out every day or two. And what we've been trying to work on with the PACE program in Pennsylvania is to provide a service to doctors that looks a little bit like the sales reps coming into the doctor's office from drug companies, but instead it's from an academic base. We see big problems with both overprescribing and underprescribing in this age group. There are some medications that older patients are given that are not good for them and they shouldn't get, and yet there's other drugs that could do them a lot of good that they may not be getting or getting as much of as they need. And so the PACE academic detailing program enables us to bring that information to them. They don't need to worry about, is this a sales pitch? Is this coming from a company? It's just our attempt to be able to have the very best clinical information that you would want to have your doctor or your grandmother's doctor be able to know, so that they can make the very best prescribing decisions, whether more or less or different choices of drugs. And it's boiled down and made user-friendly, and it's very interactive with the doctor in his or her office at a time of their choosing. And it's a way to help doctors, especially people caring for people who are in the PACE program in Pennsylvania, to deliver the very best possible care, to prescribe exactly the right medication, unaffected by any kind of commercial pressures.